Why does visceral fat make bladder leaks worse? Imagine your belly as a balloon filled with fat that surrounds your internal organs. That's what we call visceral fat, and it's more than just extra weight. It can actually influence how well your bladder works. When you carry excess visceral fat, it pushes up against your abdominal organs, increasing the pressure inside your belly. This pressure is transferred down to your pelvic floor muscles and your bladder, making them work harder. Over time, this extra strain can weaken these muscles, which are responsible for supporting your bladder and controlling urine flow. When these muscles weaken, it becomes easier for urine to leak out, especially during activities like coughing, sneezing, or lifting. Visceral fat doesn't just sit passively around your organs. It acts like an active endocrine organ, releasing substances called cytokines that promote inflammation. This chronic inflammation can damage the muscles and nerves that support bladder function. When your bladder muscles become inflamed or nerve signals are disrupted, you might experience more frequent urges to urinate or accidental leaks. Research shows that women with higher levels of visceral fat are at greater risk of developing overactive bladder symptoms. The increased pressure and inflammation make the bladder more sensitive and reactive, leading to urgency and leaks. In addition, the mechanical stress from visceral fat can stretch and weaken the pelvic floor muscles over time, reducing their ability to keep urine in when they should. Managing visceral fat through weight loss can have a positive impact on bladder health. Losing weight, especially around the middle, decreases intra-abdominal pressure and reduces strain on the pelvic floor muscles. Regular physical activity and a balanced diet are key to reducing visceral fat. Exercises that strengthen the pelvic floor muscles, like Kegel exercises, can also help support the bladder and improve symptoms. It's important to remember that everyone's body responds differently, and managing bladder health involves a combination of lifestyle changes, medical advice, and sometimes specialized treatments. Always consult healthcare professionals for personalized guidance. Addressing visceral fat isn't just about looking better. It's a vital step toward reducing bladder leaks and improving overall pelvic health.